Welcome to MedCentral. Most of us have experienced a burning type of pain in the stomach when we skip our meals. Some may have similar episodes of pain which are more severe with some associated symptoms. As all of you know, it is called gastritis. So, let's discuss about gastritis in this video. So, let's get right into the video. Gastritis. Gastritis is a condition that inflames the stomach mucosa lining the stomach. It causes stomachache and indigestion, also called dyspepsia, bloating, and nausea. Also, there can be other complications. What is gastritis? There is a protective lining of mucus called the mucosa. This protects the stomach from strong acids which are secreted from the stomach. When this lining got damaged or weakens this lining, the mucosa becomes inflamed, causing gastritis. Helicobacter pylori is the commonest bacterial cause that causes gastritis. Risk of developing gastritis rises with the age. Older adults have thinner stomach linings, decreased circulation, and slower metabolism and mucosal repair. Also, they may be having non-steroidal anti-inflammatory drugs. About 2/3 of the population is affected by H. pylori infection, and more common in lower socioeconomic groups. There are two types of gastritis: erosive or reactive, which causes inflammation as well as erosion ulceration of the stomach lining. Causes are alcohol, smoking, NSAIDs, corticosteroids, viral or bacterial infections, stress from illness or injuries, non-erosive inflammation without ulceration. Causes of gastritis: alcohol abuse, autoimmune disease, bacterial infection, bile reflux. Some drugs such as NSAIDs, corticosteroids, physical stress like severe burns and brain injuries, psychological stress. Symptoms of gastritis: burning type, upper abdominal pain, nausea and vomiting, bloating, loss of appetite, losing weight, vomiting blood, feeling extra full during or after a meal, black, tarry stool, stomach ulcers. Can gastritis be spread from one to another? Gastritis cannot be spread from one to others, while the H. pylori infection can be transmitted to others via the fecal-oral route. So good hand-washing practices and a clean water supply are the first line of defense against the H. pylori infection. Diagnosis of gastritis: breath test, blood test, stool test, upper GI endoscopy, X-ray after taking barium meal. Treatment of gastritis: if there are H. pylori infections, antibiotics can be used. Antacids, calcium carbonate medications cause reduced acidity of the stomach by relieving inflammation and heat burn. Histamine H2 blockers, cimetidine and ranitidine decrease the production of stomach acid secretion. Proton pump inhibitors, omeprazole and esomeprazole also reduce acid production. There can be many complications if you didn't treat gastritis. Anemia. Pernicious anemia due to lack of absorption of vitamin 12, which causes the pernicious anemia. Peritonitis. Gastritis causes ulcerations. If the ulceration occurs through the full thickness of the gastric wall, it is called perforation. It causes the leakage of gastric content to the peritoneal cavity, causing peritonitis. It can also lead to sepsis, which can be fatal. Stomach cancer. There's a high association with the H. pylori infection. How to prevent gastritis: hand washing before handling the food and before eating, and using clean water supply and proper sanitary facilities can also be helpful to prevent the H. pylori infection. Avoiding fatty, fried, spicy, or acidic foods. Lowering the caffeine. Managing stress. Omitting NSAIDs. Taking smaller meals throughout the day. Stop taking alcohol. Avoid sleeping after taking meals. When to call the doctor: blood and stools, bloody vomitus, extreme weakness or fatigue, uncontrolled gastroesophageal reflux disease, weight loss, recurring gastritis. That's it for this video. Subscribe us for more videos regarding health tips. Also check out other videos on our channel. Thank you for watching.